Next, we are going to change and talk about the catalyzing change that's happening in healthcare. We're going to talk about how traditional science is being blended with innovative technology to make healthcare more affordable and more accessible. I'd like to welcome Ann Wu to the stage. She's going to be our moderator today. She's the Director of Corporate Social Responsibility at Samsung. And joining Ann is Irwin Redlener, the President and Co-founder of the Children's Health Fund, and Seth Ammerman, Medical Director, Mobile Adolescent Health Services of the Lucile Packard Children's Hospital in Stanford.
Good afternoon, everyone. Yeah, you can hear me now. Thank you for being with us today. Hello? Okay, so I can do this without. So, we're really excited to be here today to talk about a really exciting project that has been going on for the better part of a year now. And it's something that we find really special, and part of the exercise of the project that we took on was the idea that we were going to share this with everyone. So we're here today just to talk about this partnership that we have. So just to start out, I'm Ann Wu. I'm Director of Corporate Citizenship at Samsung Electronics here in North America. I have counterparts all in different regions all around the world, and though we're a global company, my focus area is really in the US and Canada. And so, I have two wonderful partners here with us today, so I'm going to let everyone introduce themselves, and then we'll start the conversation. So, Dr. Redlener, would you like to begin?
Well, first of all, I just want to say how happy I was to hear about dementia, people thinking about it as I get older. It's reassuring. I'm Irwin Redlener. I'm a pediatrician by background. I am the co-founder with the singer Paul Simon of an organization called the Children's Health Fund, which we started in 1987 to address the extraordinarily complex healthcare problems of homeless children in New York City. And we now have a network of programs across the country, including the one that Seth runs here in the Bay Area. But they're all about providing access using innovation and other techniques to try to make sure that every child, no matter the conditions under which they live, has access to high quality, continuous, comprehensive health care. No small feat. There's millions of children that need to be helped, and I'll talk more about that in a minute. But Seth?
I'm Seth Ammerman. I'm a pediatrician and adolescent medicine specialist at Lucile Packard Children's Hospital, Stanford, and Stanford University. And I'm medical director of the Teen Health Van program, which we'll be talking about. And the Teen Health Van is actually going to be here. So if any of you would like to tour it, after the session is over, it'll be outside near the tent. And I'd like to encourage you to do so. For those of you who are parents of children and teenagers, I'm going to give you some good news, which is now that the official definition of adolescence goes through age 25. So you have a lot to look forward to.
Kind of mind-blowing a little. And they come back, so I hear. So
yes.
After they leave. So we'd like to start off by just taking you through the sort of the project, but really to start out, we wanted to share a little with you about the relationship between Samsung, the Children's Health Fund, and the Lucile Packard Children's Hospital, Stanford. At the beginning of 2014 at Samsung, we were given a very special gift as employees all around the world. It's something called the New Management Initiative. And so we got a special gift from our management team, but part of that gift was were funds that we were able to donate to organizations at our choosing. So here in the United States, we decided to have employees vote on how the funds, their bonus, would be distributed. And we, through that employee vote, $1 million was donated to the Children's Health Fund. And I think, Irwin, you tell the story from your side quite well, but from our side, one of the reasons why we decided to give to the Children's Health Fund was this idea of a mobile medical unit. We understood from a lot of research that we had done that there are underserved communities all around the world, all around the country, especially in urban and rural areas where getting comprehensive primary care is really hard. And consistent care being really important as well. And we felt that the Children's Health Fund, in how they ran their program, was very interesting. So unlike other partnerships we have, which are long-term commitments and partnerships, we actually cold called the Children's Health Fund and shared this announcement with them.
You can imagine this cold call of somebody saying they had $1 million that that their employees had decided to give to the Children's Health Fund. I don't think we had a conversation prior to that ever, and it was really out of the blue. And I think that we've had a lot of corporate donations over the years since we started our program in 1987. But I would say that this was the first of a kind in terms of a relationship, because what we found is that we had an alignment of mission and of persistence in terms of dealing with a particular kind of problem that we have with Samsung that was really quite unique among all the other donations that we've gotten over the many years that we've been working. And what this is about, I think, is something that I think is worth sharing with you, because what it is this. So as physicians or anybody providing human services to people in need, there's always the reality that you're helping a life, and that's of tremendous value. My glass has always been kind of half empty, and what I'm concerned about is the fact that there's actually millions of children in the United States who don't have access to health care, and some of them don't have access in ways that allows them to have persistent medical problems that actually interfere with learning. A very terrible double whammy for children living in poverty. But the scale of the problem is enormous. And one of the things that we are excited about in working with Samsung is that they're a huge company. They think big. They're not daunted by the scale issue. And this is something really very exciting to us. So what we've created is a Samsung Innovation Center at the Children's Health Fund, where we're going to be working on how to optimize the use of technologies available now, technologies that might be available in the future, along this single goal, toward this single goal of improving our ability to give access to quality health care to children, lots of children. So we want to set up very usable models that can be exported to large numbers of children who are in need. And the thing that happened most recently was, as Seth is going to talk about, a launch of our, by the way, we have 53 mobile medical units in our fleet right now, and I do hope you take up Seth's invitation to go look at the one that's coming up here, because it is the most technologically advanced mobile health center for children in the world, as far as we can tell right now. And it's loaded with usable technologies that are improving the way we can access, provide access to children, and also improving the ability for those technologies to be exported to other places. So it's quite something, and I hope you do take a look at it, but that's more or less what we're looking at with Samsung, a unique partnership between a very powerful, gigantic global company and an NGO, a not-for-profit organization that's committed to fixing a very large-scale problem. And by the way, I think the only way we're going to solve some of these big problems is by innovating and by scaling up. And the scaling up part of this has always been a mystery in terms of, or at least has been a barrier for many of the people and organizations working on problems. We want to build houses after Hurricane Katrina, for example, and we build Habitat for Humanity, a wonderful organization, will build 10,000 houses, but they need 250,000. So bridging this scale issue is something that we're hoping to kind of keep developing with Samsung, our partner.
So part of our donation was focused in the Bay Area, and in our discussions with how the funds would be used, in discussions with the Children's Health Fund, the Bay Area came to mind. There was a mobile medical unit that was about 19 years old and a bit on its last leg. So Dr. Ammerman, could you give us some background and tell us about the new van as well?
Yeah, so when I founded the program with the help of the Children's Hospital and the Children's Health Fund, We're in our 20th year of service, but back then, mobile healthcare had not been really established, and what one did was actually buy an RV and then have it retrofit to become a mobile clinic. And ours was on its last legs. It actually was red flagged, but so the timing couldn't have been better for the funding from Samsung and other generous donors to help us purchase this new vehicle. And the cool thing now is that because mobile healthcare is now a proven way to provide healthcare to underserved populations, there are now 4 companies in the United States that make mobile clinics. And we actually we put out a competitive bid, and there are templates that are used, and we can really get what we want in terms of the specific population that we are targeting. And the cool thing about this new vehicle is, first of all, the quality is so high compared to our old one. And secondly, thanks to Samsung, we have all this great technology that normally would first be used by wealthy people inside the academic center, and that's where it would start, and then it would trickle down ultimately to the underserved population. Well, this is a reverse model where we're actually now using it first and engaging the use of this technology with underserved population, and I just think it's fantastic.
So one of the things we wanted to do beyond just being a donor and giving product, which is something that a lot of companies do, is we wanted to collectively think about what we could all bring to the table with this project. Obviously, Dr. Ammerman was, and his work needed a new mobile medical unit. The Children's Health Fund has the know-how and the fundraising capability to do it. But because we have this opportunity to build this mobile medical unit from the ground up, in a custom way, in the way it's built, we decided to take a new approach. And so at Samsung, new product development is something that we do. It's part of how we make products, and we bring them to life for consumers. So we introduced that a new idea, a new way of looking at things, by applying the new product development, the new concept development model into our discussions. So one of the things we did is we partnered with another agency, but we actually all came to the table. We started to observe the old mobile medical unit. We learned how it worked. We learned how healthcare providers move around the vehicle. We saw actual patients come in and out of it, just like how we would try and iterate and identify unmet needs to make the next hit product for Samsung. So we applied that knowledge, in addition to the Children's Health Fund's expertise on how to build mobile medical units, and Dr. Ammerman being the head of the program and actually works on the mobile medical unit. His boots on the ground knowledge to actually come up with a way that technology could be used in the mobile medical unit in a new and different way. We set about using existing technology, so there's nothing that was custom made in a manufacturing plant just for this mobile medical unit. They're products that you can actually go and buy right now. And so we identified 5 different use cases that we thought would be interesting, obviously in collaboration with Dr. Ammerman, and incorporated them into the mobile medical unit. So I can give you 1 or 2, but perhaps Dr. Ammerman, you can share as well. So one of the interesting observations we saw was that for a lot of these patients who are teenagers, giving them information after they leave the mobile medical clinic so they know all the information they need to know, post-visit, was often done by giving a photocopier as a handout. We saw accordion files, where there was a printout or there wasn't a printout, depending on if it was in the folder or not. So we actually incorporated a wireless printer in there. So on-demand printing can guarantee that the patient, after their visit, can go home with the information they need every time. Another one that we did was actually something called mirroring technology. So calling up a visual on a tablet, actually mirroring that image onto a TV screen, so the doctor, the doctor and the patient can look at the same image at the same time. We have something called an S-Pen technology where you can draw over the image and actually provide in some detail, more, in a very interactive way, information about what their care is and what the issues are. Would you like to talk about maybe a couple more?
Yeah, well, let me say the mirroring technology is particularly exciting because I'm next to a patient and I'm holding a tablet and I can either pull things up on the web or I have preloaded patient health information and we look at it on the tablet, but then it's on this 32-inch screen that's in the exam room and we can draw on it. And so we can make notes, or the patient can say, this is where this is the problem, and so on. And it's a highly interactive, engaging type of technology, which for the patients that I work with, for youth, it's really important. And they love it because, of course, they're all used to using devices, and this is a really cool device. And then we can download it all on the computer. We can save it. We can print it out wirelessly, as Ann mentioned, and so there are all kinds of cool things we can do with it. And when we download it in the computer, then when the patient comes back next month, we can show, well, this is where you were, and now these are the changes, and so on. Some other cool technology that we have is the old oto-ophthalmoscope, which you're all familiar with when I look in your ears and your eyes and your throat. This now, on the screen, the patient can see what I'm looking at. So for the first time, they can see what their inside their ear looks like, or what the inside of their eyeball looks like. We have a dermatoscope, which is if a patient comes in with a rash, I can do the same thing, and the rash is magnified, and so they can see exactly what it looks like big, but more important from a healthcare point of view, I can actually send that to a dermatologist, either live or download it to the computer, and at the end of the day, the dermatologist could look at it if I need that person's input and say, well, this is what it may be. So those are some really cool examples of what we're using, and the kids are really engaged by all this, and it's improving our ability to provide better health care, because normally if I needed a specialist, we also have a stethoscope that is similarly where the kid can hear now what their heart sounds like or what their breath sounds are like. And again, this can either be downloaded or I can send it to a cardiologist live or a pulmonologist, and they can give me immediate feedback if I'm worried about a heart murmur that I'm hearing for the first time. So the potential for this technology is fantastic, and rather than having to make an appointment with the specialist that may occur a month or two later, may be very difficult for the kid to get to, because often they don't have cars, they don't have money, they have lots of difficulty getting to the specialist. This allows us to use telehealth and telemedicine to do this, so it's really great.
Okay. So I'd just like to just touch upon what the impact has been. So the mobile medical unit has been rolling out for several weeks now. What's some of the feedback that you've received from patients?
So the feedback has been uniformly positive. The kids are really excited. First of all, when they walk and see this new van, they are really excited about just how cool it is inside. And then the new technology is really allowing us to engage them even more. So uniformly positive feedback.
And for Dr. Redlener, what is the impact and next steps that you see as
the next step is to try to make sure that this technology and these strategies are available ubiquitously, that everybody, everywhere can use these nationally and ultimately internationally. But we have a big job ahead of us, but we have a great partnership with Samsung, so we're very optimistic.
And I know the time's up, but I want to say one more thing. This program is all gift and grant funded, and all the health care services we provide to the kids are free. We don't bill, we don't charge them any money. So we're always interested in gifts and grants. If any of you are interested in donating, you can go to the Lucile Packard or Stanford Children's website, and our program is affectionately called the Teen Health Fan, and all donations are most welcome of any size. Thank you.
Yes, and just to conclude, the reason why we wanted to share this project is, as a corporate donor, we always try and sort of evolve the way we look at public-private partnerships and working with NGOs. And for us, this has been really just a great relationship and a shining example of how, you know, there is funding, there are products that we can always donate and support. But, you know, where we have partnerships where we can contribute some of our knowledge, our employees, know-how, experience to really change the conversation, these are opportunities that personally, for myself and at Samsung, we really welcome and love to engage on. So thank you to Dr. Ammerman and Dr. Redlener for actually being partners with us on this.
Thank you, Ann.
Thank you.